Hello everyone, and I hope everybody is doing perfectly fine. So today we'll be discussing an important topic, that is Hodgkin's lymphoma. So when we start, the first thing we should come in our mind that what is the difference between Hodgkin's and non-Hodgkin's lymphoma. So just see the table. What you see here is this Hodgkin's. This is more often localized to a single axial group of nodes, that is your cervical, mediastinal, and paraaortic lymph nodes. Whereas non-Hodgkin's lymphoma, they involve multiple peripheral lymph nodes. And Hodgkin's, they spread in a contiguity. They follow a pattern, symmetrical. And non-Hodgkin's, they are non-continuous in spread. Mesenteric and nodes and the Waldeyer rings are rarely affected in your Hodgkin's. However, they are more commonly involved in your non-Hodgkin's. Extranodal presentation is rare in Hodgkin, and here it is very common. So when we start with what is Hodgkin's lymphoma, so there's a group of lymphoid neoplasm. So morphologically what happens when you have to say a Hodgkin's lymphoma, you have to go for a classic RS cells. That is a neoplastic giant cell, which is also known as Reed-Sternberg cell, RS cells. So this RS cell has a quality that it releases factor which induces accumulation of your reactive lymphocytes, macrophages, granulocytes, and this which these background population, it accounts for more than 90% of your tumor cells. And these RS cells, they are derived from your germinal center or post-germinal center B cell. So when we come into the incidence part, in US, for new cancer, it accounts for approximately 0.7% and 8,000 cases each year. An average age of diagnosis is 32 years. And Hodgkin's is usually common in the young adults and adolescent age group. In fact, it was the first human cancer to be successfully treated with radiation therapy and chemotherapy. And when we'll discuss about the prognosis, I'll let you know that it is curable in most of our cases. It has a good prognosis. So this WHO, it classifies this Hodgkin's lymphoma into 5 types. So these four, why I have highlighted in yellow color, because these four represent a classical Hodgkin's lymphoma types. And this not the fifth one, that is a nodular lymphocytic predominance. It is a non-classical type of Hodgkin's lymphoma. So this classical, the four types होते हैं, they share an immunophenotypic feature of but the classical Hodgkin's lymphoma that we'll be discussing in subsequent slides. तो जो ये type 1 to 4 है, इनमें जो as I said you, they have a distinctive immunophenotypic feature, so they are lumped together as your classic forms of Hodgkin's disease. Fifth type, these RS cells have B cell immunophenotype, so that we'll be discussing. This is different from the basic four classic types. So when we come to the pathogenesis part, जो ये RS cells हैं, the origin of this neoplastic RS cells of classic Hodgkin's lymphoma, this was solved, or this mystery was solved through an elegant molecular study of a single isolated RS cells. So these RS cell, as I said, it originates from your germinal center or post-germinal center B cell. So they have proven clonal IgH rearrangements and with the telltale sign of your somatic hypermutation. So there is a somatic hypermutation by clonal IgH gene arrangements. So though we say this B cell, the origin of this RS cell is from the B cell, but the classic जो RS cells होते हैं, they fail to express the most B cell specific gene. And what is a common factor in classic Hodgkin's lymphoma? It is activation of your transcription factor NF-kappa beta. So this, once it is activated, NF-kappa beta activate hoga, the downline what it will do is, it will turn on the genes and promote growth and survival of your RS cells. And we also see association of Epstein-Barr virus in association with your HL. So Epstein-Barr virus positive हो सकते हैं, Epstein-Barr virus negative भी होते हैं. So जो Epstein-Barr virus positive होते हैं, they express latent membrane protein 1, which transmits your signals to upregulate NFK beta, because NFK beta जो central dogma, that is the main part. Correct? Then EBV negative tumor भी फिर कैसे करता है? There is a loss of function mutation in the kappa beta and the TNF alpha induced protein. So once this pathogenesis, you know, that is the activation of the NF-kappa beta pathway, and then downline the growth factors are released to stimulate the production of these RS cells. Now we should know how a RS cell looks like. So identifying these RS cells in the sections or smear, that is very much essential to give a diagnosis of Hodgkin lymphoma. So this is how the diagnostic RS cells look like. They are large cells. I will show you the image also. These are large cells, 45 micrometer in diameter with multiple nuclei हो सकते हैं और single nucleus हो सकते हैं with multiple nuclear lobe. Each will have a large inclusion like nucleolus. And that nucleolus जो होता है within the nuclei, that is actually very large. It is size of a small lymphocyte which measures around 5 to 7 micrometer in diameter. So ये है classic RS cells. देखो, voluminous amount of cytoplasm, the pinkish area you are seeing. Then what you have? You have two nuclei, एक ये है, एक ये है. तो दोनों nuclei में what you are seeing? एक pinkish छोटा सा round body you are seeing within the nucleus. That is a nucleolus. So they are having a bispectacle shape with two nucleolus in between. So this is the high power image. This is a big RS cell you are seeing. Amount of cytoplasm is more. You have two nuclei, and within the nuclei you have single nucleolus, up and down, two nuclei you can see. Aula appearance भी कहते हैं इसको. तो cytoplasm abundant है. Now this classic RS cells, there are many different types of RS cells. एक तो हमने classical RS देखा जो binucleated है. Then we can have mononuclear RS cells also. ठीक है? They have single nucleus with large inclusion like nucleolus. Then second type is your lacunar. Picture भी मैं दिखाऊंगी आपको इसकी. Delicate, folded, multilobate nuclei है, abundant pale cytoplasm है. They are disrupted during when we give sections, so they are disrupted, and you will feel like that nucleus is sitting in an empty space. That is lacunar. So lacunar variant उसको कहते हैं. तो ये है mononuclear variant, एक nucleus, उसके अंदर एक nucleolus. ठीक है? This is the lacunar variant. देखो एक बड़ा सा सेल है, nucleus है, उसके अंदर nucleolus भी है, and this whitish area you are seeing, this is the lacunae where the nucleus is assumed to be sitting. So empty space में बैठा हुआ है. So this is a lacunar variant of our RS. The third variant जो होता है, एक हमने classical RS देखा, mononuclear देखा, third we saw lacunar, fourth is your LH cells, LNH. उसका nucleus how it is? They are polypoidal nuclei, inconspicuous nucleoli, moderately abundant cytoplasm. So these are four variants you can see of RS cells. So then classic RS cells जो होते हैं, the mode of cell death. So when those RS cells die, so there is a process known as mummification. So how the cells look like? The cells shrink and become pycnotic, dense dark nuclei हो जाती है to the cells. This is the popcorn cell or the LNH cells. So these are the four variants. This picture I have taken from internet. So see, eosinophils का होना बहुत important होता है Hodgkin's lymphoma में, a very important point. So this is a classic cells binucleated. This is the mononuclear variant. ये है lacunar variant, and here you are seeing a lymphohistiocytic variant. So this is a diagrammatic representation है. Classic RS binucleated, mononuclear है, lymphohistiocytic popcorn arrangement है cells की, pleomorphic, lacunar, and this I was saying कि how the RS cell die. So the nucleus concentrate हो जाती है बीच में. It's looking a mummified structure. So HL needs to be distinguished from other conditions where the cells may mimic RS cells. Like infectious mononucleosis में जो monocytes वगैरह होते हैं, so they become so distorted and enlarged, they can mimic your RS cells also. Then solid tissue cancers में हो सकते हैं, large cell non-Hodgkin's lymphoma में भी हो सकते हैं. But diagnosis of HL, so in these or malignancy, you don't get a polymorphous cells का background. Here the difference is background you will get a non-inflammatory cells in the background of non-inflammatory cells. Presence of RS cells in a background of non-inflammatory like your lymphoid cells हो रहे हैं इसमें, ठीक है? You have different type of other cells which are, so they have a characteristic IHC profile also. So then we go to different, now we have discussed the different forms of RS cells. Now we'll go to different types of Hodgkin's lymphoma. So पांच हमने जो पढ़े थे जो classical थे चार शुरू के, nodular sclerosis you have mixed cellularity, third is your lymphocytic rich, then you have lymphocytic depleted, fifth one which is a non-classical type, that is your nodular lymphocytic predominant. So coming to your nodular sclerosis, so that is the most common form of your Hodgkin's lymphoma, 65 to 70% of cases it is seen, and this nodular sclerosis has a lacunar variant of RS cells. And here what is important is nodular sclerosis, as the name suggests, what you see here is deposition of your collagen bundle in bands dividing the involved lymph nodes into circumscribed nodule. Low power pe I'll show you how it differentiates. Fibrosis may be scant or abundant, and there is a polymorphous background of T cells, eosinophil, plasma cells, and macrophages. And when we go into the immunophenotype, it is positive for Pax8, CD15, 30, but it is negative for other B cell marker, T cell marker, and CD45. There is involvement of spleen, liver, and marrow. It is not usually associated with Epstein-Barr virus, and incidence in male female are almost equal. So there is involvement of your lower cervical, supraclavicular, periasternal lymph nodes of adolescents and young adults. Prognosis is excellent in this case. So this is, see, the nodules are divided by the dense collagen bundles है, ये pink है, ये सारे collagen bundles होते हैं, and यहाँ पे आपको बीच में nodular areas दिख रहे हैं. This is the high power where you can see dense collection of your lacunar variant of RS cells, किस nuclei sitting in an empty space. So this is giving you a lighter appearance. So surrounding ये lymphoid architecture है. Then coming to the second type, that is mixed cellularity, it accounts for 25 to 25% of cases. यहाँ पे जो involved होते हैं lymph node by Hodgkin's, they are diffusely effaced by your heterogeneous cellular infiltrate, that is eosinophil, T cell, plasma cell, macrophage, along with your RS cells. So mixed. And यहाँ पे जो RS cell होता है, that is mononuclear variant वाला RS cell. 70% cases are associated with your Epstein-Barr virus. Immunophenotype is same as your nodular sclerosis. Male has more propensity to get the disease associated with older age, and they have more of systemic symptoms like your night sweats, weight loss, advanced tumor stage, and overall prognosis is very good for this tumor. So this is mixed population hai background mein bhi, and what you're seeing is the RS cells interspersed here and there. So see, mononuclear RS cells hote hain, background mein you have different cells. The third variant is your lymphocytic rich type. Here this is usually uncommon type hota hai ye. Reactive lymphocyte make up the vast majority. With less amount mein you will get your RS cells. Lymph nodes are totally fused with vague nodularity क्योंकि होती है nodularity because of residual B cell follicles, and they are distinguished from lymphocytic predominance जो हमारा fifth variant है non-classical by presence of frequent mononuclear variants and diagnostic RS cells with same immunotype as RS classic RS cells. So this lymphocytic rich will have immunophenotype as your classic form, and जो nodular lymphocytic predominance वाला है that will have immunophenotype of the non-classical type. 40% case में EBV association दिखती है. Prognosis is very good to excellent in these cases. So this is the lymphocytic rich है, and scattered here and there we are getting the RS cells. Then comes your lymphocytic depleted form. So this is the least common, accounting for less than 5% of the total tumor. There is paucity of lymphocyte and relative abundance of RS cells or their pleomorphic forms. Immunophenotype is still is same as your classical RS. EBV association more than 90% of cases में दिखती है, and usually you notice this form in older adult, in immunocompromised individual like HIV positive, in lower income countries. And advanced age and systemic symptoms are frequent, and prognosis is less favorable. So see here पे lymphocytic depleted है, background में आपको lymphocytes नहीं दिख रहे, here and there spindle cells you are seeing, but RS cells you are seeing many. ठीक है, तो आपको obviously दिख जाएंगे RS cells ज़्यादा. Then these were the four basic classic forms of your Hodgkin's lymphoma. So now we move on to the fifth type and the non-classical form, that is nodular lymphocytic predominance type. Non-classical variant है, approximately 5% cases होते हैं. यहाँ पे जो nodes होते हैं, they are effaced by the nodules of small lymphocyte which is admixed with variable number of macrophages. Classic RS cells less to be seen here. LNH variant of RS cells होते हैं इसमें, जिसको popcorn cells कहते हैं. Eosinophils and plasma cells are also comparatively less. So they here what type of markers you will get it. So यहाँ हमें मिलते हैं B cell markers. So that is different, typical of your germinal center. So CD20, BCL6 ये positive होगा, and these are negative for CD15 and 30 जो हमारे चारों classical variants में positive आते हैं. These are negative in your this tumor. Fine. So this nodular pattern growth होती है because of expanded B cell follicle which is populated by your LNH variant of RS cells. There is numerous reactive B cells, follicular dendritic cells, And here also there is IgA genes on LH variant showing that evidence of ongoing somatic hypermutation. There is basic difference in the genetic makeup कि B cell marker positive हो रहे हैं nodular lymphocytic predominant type में. So this they have 3 to 5% propensity to go into diffuse large B cell lymphoma. It is not associated with EBV commonly. Majority of the cases are seen in males and usually younger than 35 years. They present with your cervical and axillary lymphadenopathy and prognosis is excellent. So what we saw in out of these 5, as I said you, ये पहला कैंसर मतलब important कैंसर था जिसका ट्रीटमेंट रेडियो और कीमोथेरेपी पे it was responding good. ठीक है, and prognosis overall all 4 out of 5 I think lymphocytic depleted I told you, which has a bad prognosis, a poor prognosis. Otherwise rest 4, 3 of the classical and this non-classical form they have good prognosis. So this is the nodular lymphocytic predominant. Diffuse sheets of lymphocytes hai. Individually you can see a LH variant of RS cells. This is same picture. So how now we are done with the different forms of RS cells, their genetic makeup, pathogenesis, what are the different types of Hodgkin's lymphoma, classical, non-classical, classical ke 4 types, non-classical ke we have 1 type, lymphocytic predominance, classical we have 4, nodular sclerosis, mixed cellularity, lymphocytic rich, lymphocytic depletion. So how these Hodgkin's lymphoma patient present to you when you see a patient? So they have a painless lymphadenopathy, then patient with lymphocytic nodular sclerosis or lymphocytic predominant type, they have stage 1 or stage 2 disease and they are free of systemic manifestations. Then patient with disseminated disease hoti hai, jisko hum stage 3-4 mante hain, ya mixed cellularity, lymphocytic depletion, they have more of constitutional. The stage 1-2 mein to they will, you won't be like, they don't have any specific symptom. Constitutional symptoms जैसे fever, weight loss, night sweats, ये भी stage 3-4 वाले में ज़्यादा होंगे. So there are these patients, they become cutaneous immune unresponsiveness to have because they have depressed cell mediated immunity. So this spread is stereotypic. They follow a pattern. So nodal disease you see it first, then the disease move on to spleen, then patient has hepatic disease, and finally there is involvement of marrow and other tissue. Contiguous spread hai. Staging, how you do it, we physically examine the patient. There is radiological evaluation of abdomen, pelvis, chest, biopsy of the marrow, bone marrow. That with current treatment protocol, the tumor stage rather than the histologic type is more important prognostically. So cure stage rate जो होती है stage 1 and 2A के लिए is 90%. And with advanced disease, when patient present to you in stage 4A, 4B, disease free survival is 5 years is approximately 60 to 70%. So low stage to localized Hodgkin's, they can be cured with your involved field radiotherapy. And but initially it was thought that post radiotherapy, initially it was seen actually that post radiotherapy these patients develop other malignancy like lung cancer, melanoma, breast cancer. Second hit theory होती है इसको कहते हैं. The chemotherapeutic drugs are now used. So this patient usually who failed to this chemotherapy is now very responsive in Hodgkin's lymphoma, but even then who failed for the conventional immunotherapy, they have an immune checkpoint. So we use inhibitors that block PD-1 and receptor for PD-L1, PD-L2. These are now effective drugs which are used for the treatment. So when we read HL or NHL, we have to remember the staging. So Ann Arbor staging classification, it helps you in staging the disease by distribution of the, knowing you the pattern of distribution of the disease. So stage 1 किसे कहते हैं? When there is involvement of a single lymph node or single extra lymphatic organ or a site. So that is stage 1. When there is involvement of 2 or more lymph node region on the same side of diaphragm alone or localized involvement of an extra lymphatic organ or site. That is stage 2. Stage 3, there is involvement of lymph node region on both the sides of the diaphragm without or with localized involvement of an extra lymphatic organ or site. Then fourth is what? Diffuse involvement of one or more extra lymphatic organ or sites with or without lymphatic involvement. So all stages are there further divided on basis of absence or presence of following symptom. उसको add कर दो इस stage के साथ. Unexplained fever, drenching sweats, unexplained weight loss of greater than 10% of normal body weight. So this is your Ann Arbor staging. So you can say which 2A or 2B. A है अगर 1A is like you have this feature and there is no constitutional symptom. 1B हो जाएगा कि stage 1 तो है, उसके साथ patient को unexplained weight loss, fever, sweat भी है. So 1A, 1B. So A and B is decided by the absence or presence of your constitutional symptoms. So thank you so much for your patient hearing. Kindly like, subscribe and share my YouTube channel Patho with MK. Thank you so much.